Myself, Dr. Sachin Bhatkar, Interventional Consultant Cardiologist at Srikara Hospital, Peerzadiguda. So today I will talk about the heart attack. And as we know, heart is the most important part of our body which supply the blood to the all other parts. And heart attacks are the most common cause of the death in India as well as in the world. And those patients particularly having sugar, BP, cholesterol, or any family history of heart problem or addiction like smoking tobacco, or they are having more chances to have the heart attacks. So if we reach the doctor as early as possible, then we can delay that complications like heart failure, death also. And previously heart attacks used to occur in old age, but now we are seeing heart attacks in younger population also because of stressful life, unhealthy diet, and addiction like smoking, lack of exercise. Particularly after COVID, we are seeing more heart attack in younger population. So those having chest pain, breathing problems, sweating, palpitation, or giddiness, they should reach the consultant. They should reach the cardiologist, and they should do some test like ECG, 2D echo, if require, troponin and TMT to rule out any heart problem. And if in any problems are there in ECG, 2D echo or some test, we will advise to go for angiogram. And if there are like significant blocks like above 70%, we will advise the stent to open that blocks. So to summarize, after 30 age, everyone should check their BP, sugar, cholesterol. Particularly if someone in your family is having heart problem, you should be more careful. You should stop the smoking, tobacco. And if you are having any cardiac symptoms like chest pain, breathing problem, you should consult the doctor to do the test and rule out any heart problem. If you are having symptoms like chest pain, breathing problem, or sweating, giddiness, palpitation, you should consult as early as possible to the doctor, because if we delay that the treatment, that heart muscle will get damaged and it leads to the heart failure and sometimes death also. So if you reach the hospital, doctor will advise ECG, 2D echo, if required blood test like troponin, and some patient treadmill test like stress test also. If any of the tests are showing any changes, doctor will advise to do angiogram to rule out any blocks. In angiogram, if blocks are above 70% significance, then we will advise to open that block with the stent. So it's important to recognize the symptoms and reach the doctor as early as possible. Particularly if he is having some risk factors like he is a smoker, or he is a known case of diabetes, hypertension, cholesterol, or if someone in a family is having heart problem, if they are having typical symptoms like a chest pain and left hand pain, sweating, they can take the one tablet, sorbitrate tablet below tongue, or aspirin. Aspirin is there, 300 aspirin, but they should reach the hospital as early as possible to nearby hospital, because after taking tablets, just it will give some relief for few minutes, but we should go to the hospital, and ECG is must. After ECG, we will get the idea whether it is heart attack or like non-heart attack pain and all. In the meanwhile time, you can take that sorbitrate below tongue, one tablet. It will increase the blood supply to the heart, but temporarily it will be helpful. Preventive steps like most important is diet. You should avoid the oil items, fried items, non-veg. We should decrease the non-veg, and some like at least minimum 15 minutes per day exercise is must, at least 5 days per week. And we should stop that all addictions like mainly smoking, tobacco, chewing and all. And yearly you should check your all like BP, sugar, cholesterol, everything you should check yearly. If any problem is there, doctor will advise that tablets to control that sugar, BP, cholesterol. That is the most important things. And if someone in your family is having heart problem, you should be like double cautious. You should not neglect any chest pain or any problem. You should consult the doctor as early as possible, because there are chances that if anyone in having family heart problem, there are hereditary causes also. They are more prone for the heart problems.